Now to a health alert. You're going to notice another label to read on many of the foods that you eat. Gluten-free labeling is now in effect. It's not mandatory, so you may have to read the ingredients list as well, but it will definitely simplify life for those who have been diagnosed with a gluten sensitivity. So what is gluten and why is it important enough to identify on foods?
Many companies had already jumped on the gluten-free labeling bandwagon, but today is the day the FDA started to require all of its regulated foods to carry a label.
But it's still not perfect, and it's not universal.
Bon Secours gastroenterologist Dr. Sullivan says it's still important that you read the ingredients.
Looking for wheat, barley, and rye is really what's going to, spark an idea that there's gluten in this product.
Gluten is a protein that thickens bread and pasta, for example, but can do a number on people with gluten sensitivity and celiac disease, a corrosion of the small intestines.
They still feel that the vast majority of celiac patients are not diagnosed, and some of it is that they don't present to their doctors. They feel they have just indigestion.
Even Dr. Sullivan had it for years.
And I was already a gastroenterologist.
How did you miss it?
I didn't check on myself.
He shrugged it off as heartburn.
And it was only after I had an endoscopy to evaluate the reflux that I was found to have celiac disease.
Nutritionist and fitness expert Jim White says that he hears this all the time with his clients. 10 out of 350 of them have been fully diagnosed. And when they dropped gluten, they became more athletic and lost weight.
So when you start eliminating gluten, there's a lot of carbohydrates. So most people start losing weight because they're eating less.
But he says eliminating carbs just to avoid gluten is not the way to be.
The ones that do the best are ones that are incorporating still whole grains, such as brown rice, such as sweet potatoes, such as quinoa.
So Dr. Sullivan says that the blood work is so much better these days to diagnose celiac. However, they can still miss a gluten sensitivity. He still says get screened if you suffer from reflux, bloating, and even dermatitis, especially after eating carbs or drinking beer. Janet?